Hi everybody, this is Dr. Bulow with Revive Upper Cervical, coming to you again to talk about concussions. And in today's episode, I wanted to talk about an issue that a recent patient was experiencing when they came in to see me the other day. What he said was, after he had his concussion, every time he would go to work, he couldn't focus, right? So when you go to work, there's a lot happening. There's a lot of people moving around, there's a lot of noises. If you're sitting near a window, there's cars outside, and there's buildings and light coming in. There's the fluorescent lights. Take, for example, a student when they go to school, and there's all the people moving around them in the hallway, and then they sit down and they have to look at a chalkboard, and they have to read, and they have to write. A lot of times when we're in a state where our brain has to perform multiple tasks at one time, our brain shuts down. You know, we become just frustrated. We can't think clearly. We can't form words. We might even get blurred vision. We get headaches. We might get nauseous, anxious, depressed. When our brain is asked to perform a task that requires a lot of brain activity, so thinking, studying, reading, working, communicating on the phone, communicating in person, solving problems, and our brain shuts down. The question is why? Why does the brain shut down whenever when information's coming at it from different perspectives? So there's a couple different reasons why, and I'd like to talk about one of them today. Part of the reasons why go into most standard concussion theory, and I did a video on that. It's called What Happens in Your Brain During a Concussion, and I kind of go over the main theories, but I'd like to give you a different aspect, a different theory as to why specifically whenever your brain is asked to perform cognitive function, you get symptomatic. And it comes down to something called the reticular activating system, the RAS, the reticular activating system. It's a portion of the brain that's located in the brain stem, right here at the point where your skull is sitting on your neck. And the reticular activating system regulates how alert you are. Okay, they talk about how it wakes you up when you're stimulated, you know, it wakes your brain up. Well, one of the things the reticular activating system does is it takes in all of the stimulations, all the visual stimulations, balance stimulations, hearing stimulations, all of the input before you're even aware of it has to go through the reticular activating system. Some research shows that whenever you're called upon to be alert or mindful of a situation, there's an increase in blood flow to the reticular activating system. So again, the more your brain has to perform, this reticular activating system wakes up, and one of the jobs, and this is what's interesting about it, one of the jobs of the reticular activating system is not only to alert the upper parts of your brain about things that are important in your environment, it's also the job of the reticular activating system to filter out the things that are not important, right? So how many things are going on in your world right now that you're not even really aware of? You know, the hum of the air conditioning, the pressure of the seat underneath of you right now, the tension that your shoes put on your feet, the feel of the collar around your neck, some stuff that happens all the time that you're just not aware of. It's like a baby, a newborn baby. You clap real loud and they startle when they're sleeping. And then you clap again, and you clap again, and pretty soon they don't startle. Because that reticular activating system learned that's not a legitimate emergency, I'm going to turn that off right now. So imagine now someone whose reticular activating system isn't working properly. Now the brain is made aware of all these stimulations that it normally shouldn't have to worry about. But now it's worrying about. On a subconscious level, the brain is worried about all these different things. So when someone has a concussion and they try to go back to school or they try to go back to work and these different stimulations are coming at them, the brain can't process it. It's too much. It's an overload. And so what happens to that person? They get anxious, super anxious. You can have panic attacks, shortness of breath, headaches, mental fog, frustration, problems forming new words or conversations, having conversations. A lot of that comes back to the brainstem, the reticular activating system, and how well the brain is processing all of that information. So in our mind, if someone is having those sorts of experiences, those sorts of symptoms after having a concussion, one of the best things they can do is have an evaluation to see if there's any pressure or irritation or dysfunction in this brainstem. One of the things that we advocate is paraspinal thermography, a way of measuring temperature regulation, because that's something that the brainstem monitors. And if you'd like to have that sort of assessment done, please let me know your zip code. I'll find you a provider in your area that does thermography in the sense that I'm saying. Otherwise, if you have any questions related to concussions, related to the brainstem, related to the upper neck, please ask them in the comment section below. And of course, if you know someone that's suffering and that has these sorts of issues, please take the time to share this video with them. You have no idea how those sorts of basic steps could radically change and improve the quality of their life. So thanks for spending the time with me today. We'll see you guys next time. Bye now.